Thank you, Chair Nose, Vice Chair Goodwin, members of the committee. For the record, I am Travis Nelson, the State Representative for House District 44. I'm a registered nurse, and over the course of my 19-year career, I've served the nursing profession at the state and national level, and I've worked as an ER nurse, a critical care nurse, a case manager, an employee health nurse, a nursing home nurse, a skilled nursing nurse, the charge nurse on an inpatient rehab unit, and I've worked as a union rep for nurses. Committee members, I am here today in support of House Bill 2697. This bill would provide much needed relief, not just to hospital nurses, but for all allied health care workers. The vast majority of Oregon's nurses have regularly reported that they have suffered moral injury, compassion fatigue, and are just not able to provide quality care due to unsafe staffing levels, impacts on their mental health, and physical exhaustion. The top reason cited for these feelings of stress, burnout, and being overwhelmed? Not having enough staff. I am someone who wanted to be an ER nurse until I received the training and started doing the work. Like so many other ER nurses, I quit because of staffing-related burnout. Unfortunately, like too many healthcare workers, I know what it is like to have a patient die on your watch, a patient with a spouse, a patient with children and a family that loved them, only to know that that patient probably would have lived if I had had less patience and was able to catch the signs that they were in trouble sooner. According to Johns Hopkins, medical errors are the third leading cause of death in the United States. And a study published by the New England Journal of Medicine in January of this year showed that 1 out of 4 hospitalized patients experiences a harmful event, many of which are related to insufficient staffing. Ask yourself, if your loved one had a stroke or a heart attack, would you want a healthcare team that hadn't slept or wasn't able to give your loved one the attentive care that they deserved? Would you want to have to question if the hospital did all they could to save your loved one if they died? I can tell you with certainty that there are things that I caught when I had a safe patient load that I might have missed if I would have had too many patients. House Bill 2697 is not only needed, but it is critical. Oregon is facing a hospital staffing crisis, the heart of which is turnover. This is a work environment crisis as much as it is a staffing crisis. Frontline healthcare workers are telling us that they will not and should not, and that they will not continue working under these conditions. And 80% of our state's nurses have reported that their units are understaffed. And 99% of nurses said that their units are sometimes or never staffed appropriately. And furthermore, there is a tremendous amount of interest in this legislation, as you can see by the folks here in this room. I get asked about this bill more than anything else I'm working on, second only to the Universal Healthcare Governance Board. And when I checked this morning, 270 pieces of written testimony had been submitted in support of this bill, with only 9 submissions in opposition. Last paragraph. House Bill 2697 addresses these concerns and issues with common sense provisions that will require a minimum number of staff on a specific unit in order to provide safe patient care, and it will create accountability for failing to follow Oregon law. I believe this bill is a recruitment and retention legislation. It's anecdotal, but I think that healthcare workers will come back to patient care, and Oregon will attract nurses and healthcare workers from across the country if we show that we have their backs by creating safe workplace standards. Even the hospitals have acknowledged that staffing-related burnout is driving workers away. All Oregonians deserve access to the highest quality of healthcare, and I believe that this bill will save lives and make our hospitals safer. I also believe that Oregon's healthcare workers deserve protection and support for their crucial life-saving services, and I urge you to pass House Bill 2697 out of committee. Thank you.